name is Taylor McPartland. I'm the CEO of ScaleHealth for anyone that I haven't had a chance to meet with yet. Thank you all for joining the second webinar for the CHIME ScaleHealth Workforce Challenge. Really excited to be here with you all today, and excited to hear our featured speaker and guest, Frank Liao from UW Health. This webinar, if this is the first time that you've joined us, is a great opportunity for any of you that are participating in the challenge or considering participating in the challenge to hear more about the process, and to ask any questions of Frank, of the participating health systems, or of ScaleHealth in general, that may come up as you continue to fill out the assessment process. But these challenges that we do in partnership with CHIME are an amazing opportunity for all of you to be able to get your company, your logo, and your team in front of, in this case, 10 health systems around the country that are interested in learning more about solutions, learn more about your solutions. And so with that, again, I'm beyond excited to be here. Please ask any questions in the chat that may come up, and we'll be sure to do our best to get to them over the course of the webinar. But before we dive in, I'd like to hand the floor over to my good friend and partner, Keith Friedenberg, the COO of CHIME.
Thanks very much, Taylor. Absolute pleasure to be here with you all. If this is your first time joining one of the challenge webinars, let me just take a moment to introduce CHIME. We're the College of Healthcare Information Management Executives. We're a nonprofit association of digital health leaders. That includes executives like CIOs, CDOs, clinicians who are digital health leaders, and many, many other roles and responsibilities on the provider side of the health and care continuum. Our members represent roughly 5,000 healthcare organizations spanning 47 countries and more than 36,000 facilities and hospitals, health systems, and other related care provider facilities. These are the health IT executives and decision makers on the provider side of the health and care continuum. So their jobs are really, really important. One of the things that CHIME does to support our members, again, who often feel the weight of the world on their shoulders, whether it's financial concerns, it's competitive pressures, or specifically the weight of so many workforce challenges today, CHIME is really here to help. And one of the ways that we can do that through CHIME Innovation is we help them identify innovators and other innovative solutions across the ecosystem so that we can get solutions to our CHIME member organizations faster. We need to accelerate innovation. We need to accelerate getting innovative solutions into the health and care ecosystem. And really, that's where this great partnership between CHIME and ScaleHealth sort of sits, and these challenges. And that's why these challenges are also so important. Not only are we able to specifically target very, very difficult issues for provider organizations in the industry, but more importantly, what Taylor and I are trying to do by bringing ScaleHealth and CHIME together is link these two critical ecosystems, identify innovators and innovative solutions, and accelerate getting solutions out into the industry. So we're a proud supporter and partner of ScaleHealth. Thank you, Taylor, again, for working with us on this particular challenge. We're here to help. If you're here and you're interested in the challenge, I just want to say thank you. Also, thank you for what you're trying to do to improve digital health and care every day. So with that, Taylor, I'm going to turn things back over to you in India.
Fantastic. Thanks, Keith. And one of the things that Keith always mentions that I love so much in terms of our collaboration with CHIME is when, as an innovator, when you are working with CHIME, you're working with a decision maker, and that's what we aim to bring to the table as well. We want founders, we want thought leaders on the innovation side, being able to directly engage and interact with thought leaders from, in this case, 10 health systems across the country. And that's what these challenges are for. That's what we aim to do, is bringing these two sides together and saving time and saving money on both sides, and driving impact by creating this collaboration of complementary ecosystems. And so with that, it's my pleasure to hand it over to India Williams, good colleague, friend of mine at Scale Health. She heads up our operations, and she's going to be taking it away from here.
Awesome. Thank you so much, Taylor and Keith, for the intro. As Taylor mentioned, my name is India Williams. I lead operations here at Scale Health. I want to welcome you all to the second webinar as a part of our joint Scale Health and CHIME Workforce Challenge. It's great to see lots of familiar faces from last week's webinar, so appreciate you for joining us for our second, and hopefully you'll stick around for next week's third and final webinar, which Taylor will reference towards the end of today's session. Just to go through a few housekeeping items before we kick off today's conversation with Frank, who I'm so excited is our special guest today. I just want to talk about a little bit of what the next hour or so will entail. So I'm very excited to lead a quick conversation with Frank over the next maybe 20, 30 minutes or so. And we're hopeful that towards the end of that conversation, we can answer any questions that you might have. And so as Frank is sharing his insights and perspective, if you have any comments, questions, feedback, please feel free to use the chat to share your thoughts. And at the end, I can kind of facilitate a little bit of a dialogue so we can make sure that you get some of your questions answered and help inform your applications as a part of this challenge process. So with that being said, I'm so excited to introduce Frank Liao. Frank Liao is the Senior Director for Digital Tools and Emerging Technology at UW. Frank, very great to see you again. Thank you so much for being here with us. We appreciate the time.
Thank you, India. Sorry to get off mute there.
I get it. These things are still challenging after all this time. I still have difficulties with it as well. So we're in this together. To kick things off, Frank, can you go ahead and maybe just start with a bit of intro, just background on yourself? Can you introduce those on the call who are not familiar to UW Health? Just tell us a little bit about some of your goals and focuses there and about the organization at a high level. And then you have such a fun, interesting title. Let's talk a little bit about your role at UW, please.
All right. So I think I'll start then with maybe UW itself and then move on to like my role, as you mentioned, India. So UW Health is, so I guess lead off, it's always helpful that we're talking about University of Wisconsin. So more the frozen part of America and not the Pacific Northwest. So my boss chair and I joke that, one of our measures of success or OKRs will be when we say UW and everyone thinks of Wisconsin first. So we are the academic medical center for the University of Wisconsin, basically located in South Central Wisconsin. We also span, our footprint goes into Illinois, though a lot of people don't realize that. Not sure, like in terms of people's healthcare background here, I'll just be a little bit more comprehensive. So we're basically primary care, specialty care, as well as hospitals. So we sort of cover a wide range of specialties as a teaching hospital. There's different levels of care. So we go everywhere from primary to what you would call like tertiary, quaternary care. And we often are a feeder for the whole state and for the whole region as well. So essentially like a larger health system that includes things like hospitals, clinics, specialty clinics, multiple geographies, multiple specialties, as well as a teaching component with our affiliation with the university and a strong research component. I think if I get a little bit more specific around the intro to UW Health, I definitely think that part of our vision is technology as a value enabler and not merely as just an order taker, like, hey, we need to like run the IT systems that keep the hospital running. But we are always thinking about how technology can be a value enabler. And what I mean by that is there something that the health system wants to do or something that we need to do in order to advance the practice of medicine? And technology can get you from point A to point C, right? In other words, without technology, you can only get from point A to point B. But when you put technology into the mix, it now becomes a value enabler to allow you to do something that you couldn't do before. And so that's really our vision here. And I'll give you an example of that. You might have seen in the news earlier this year, we're one of the first health systems to start using GPT within live clinician workflows. We're basically using that now as a tool to see if it can help with our workforce and helping some of our physicians and now our nurses manage some of the electronic messages that come in. So we started that back in April as one of the first health systems to actually deploy GPT into live clinical practice as a way to see if technology can be a value enabler and understand the benefits and the risks around generative AI. So I think that example kind of shows you where we are in terms of how we can always be leveraging technology for, highest value to the rest of the organization. I guess a little bit about myself. My role is Senior Director, Digital Health Emerging Technologies at UW Health. I report to our CIO, so I'm a member of what we call OCIO, or Office of CIO. And for us, emerging technologies spans everything from artificial intelligence, like I mentioned, as well as things like machine learning, consumer-centric technologies, as well as virtual care and some of those other areas. I'm also a partner, the technology partner to our innovation office, known as the ISMIS project there too. So I work very closely with when we think about innovation and startups and our existing players as well, new partnerships with them. I'm often the technology voice there within our Office of Innovation.
Fantastic. For those of you in the audience, I want to make a quick reference so you'll maybe recognize some of the questions that I'm asking to Frank, and that is done intentionally. So we want to make sure that across these webinars, as a part of this challenge process, you're able to hear how our participating health systems all are kind of viewing these same topics. And so you may hear me asking some very similar things that we got Reed's perspective on last week. Now we'll get to hear some of the unique points that are, particularly relevant for Frank and his team at UW. And so please feel free to ask any questions related to those unique points here. And Frank, you were already kind of going into my next question a little bit, hearing that you're a part of kind of this larger innovation team. Is there anything else that you want to add to the conversation in terms of either how you view innovation specifically and personally, or how UW views innovation at large?
Yeah, I'm glad you asked that. It's a good place to start, because I do think innovation is kind of a loaded term. And I think in healthcare, often it's kind of a bad word, just because I think people use it as a way to say, hey, we're going to disrupt and turn everything upside down. And sometimes for like the core people within the health system that, they're not sure what that means. And so I think it's funny. I put that into ChatGPT earlier today and said, hey, define innovation for me in the context of a healthcare system, right? And so I think it was helpful to see that, technological advancements is only one way to think about innovation. There's also innovation in terms of healthcare delivery and treatment options. And I remember that being one of my lessons when I first got to UW Health. I was pulled into some kind of a work group with some senior leaders for a new facility that we're building. And we were the work group on innovation. And we started to have some kind of a breakout session over dinner. And I remember I was all ready to talk about data and data science and some of the opportunities I was seeing there in this new facility. And the other people in the work group just led off with, what are the latest innovations in treatment with radiation therapy? And of course, this building and facility is actually going to have a lot of innovation there. So innovation, I think, to me is kind of nebulous. And I think the most important thing is that it's really a mindset. And it's a mindset around using new tools and new processes to try to improve healthcare.
I love that. Innovation as a mindset. Yeah, we should put that on a t-shirt. That's awesome. And you referenced that your kind of department is responsible for thinking about how you collaborate with innovators and startups. And so I want to talk about that a little bit, maybe even through some examples. I know you kind of touched on how you guys are utilizing GPT, but for more of the startup space, can you share a bit on how you guys view those collaborations and what that process may look like at a high level?
Yeah, I think since I'm speaking with a lot of, I think I would say innovators, I would say from an outside-in perspective, it's a painful process because I think the health systems tend to move a lot more slowly than a lot of our startup partners would like. And I know that that's always a big part of the discussion. I think beyond the process itself, I think we're always looking for ways that technology can do something that's useful, that is more than just a shiny object. Hey, some bells and whistles, but what kind of real practical problem does it solve for the health system? And I think that's where innovation really starts to take on some more meat, which is take an idea that's out there, something that may be kind of a concept, but have a little bit of meat on the bones. And then how does it actually solve a real problem within the delivery of healthcare? And real problems can be everything from, what is a workflow that a clinician goes through, or what are some of the operating issues within the hospital, right, as the hospital is running itself. But I think finding that connection between the technology and the problem that it solves is another key part of this. The third thing is, I talked a lot about technology as a value enabler. We really extend that too when we think about these partnerships. And so some of the things that we thought about is how do we measure value then as we go down this partnership? If we want to start with something like a proof of concept or a pilot to say, hey, how can we take this idea, this new tool, and really put it to bear within the health system? How do we define value? How do we define success? As an example, we are working, for example, with one of our partners here, where we've deployed certain AI algorithms in the imaging space. And we're actually talking about value analysis that we're carrying out, but we actually kicked off like a statement of work to basically measure the ROI of those algorithms and what actual dollar value we can ascribe to running these algorithms in production that we've seen in the last 2 years. And so we start to talk about business value analysis and how do we measure the value of this solution.
Awesome. You started to actually go into my next topic as well, which is related to just some of those challenges in, moving innovation forward in this system that can be a little bit slow to adopt. And I want to make sure, it's really crucial for us on our side that we talk about, your minimal expectations and what you like to see from new technologies, from startups in order to consider engaging with them. And so that could look like an understanding of certain HIPAA requirements, certain regulatory requirements, having secured a number of pilots or partnerships, customers, whatever that may be. Like, are there things that come to your mind that as you'll, in the process of reviewing these applications through this challenge, what would you be looking for to, understand a business's traction and determine your willingness to want to move forward with conversations on potentially partnering with those solutions? Yeah,
I think when I first came to UW Health, because I didn't always work in the provider space and I actually have time on the vendor side as well. I remember telling one of my friends, like, hey, I'm now at UW Health and we're going to do all this stuff with, at that time, some of our initiatives were deploying some machine learning models directly within patient care. And just all this great work we're going to do. But I was telling him how it's so much slower here. And like, I just want to turn this algorithm on and start using it. And he made a comment around, I'm just so glad that, my doctor isn't just jumping on like the latest thing or that thing. And it was just a good reminder, even from this outside perspective of what are the stakes here when we think about patient care and all the pieces that we have to think about that are unique to healthcare and different than something like the gaming industry, which is generally very progressive, can always use the latest technologies. But it's a very different set of considerations when you're talking about, deploying something to your users for a gaming platform versus deploying something to physicians who are making really, really high stake treatment decisions. So back to your question, India, around the process, there are a lot of things that I think have to go through. And I think that's the benefit of this challenge, is that there is a lot of nuts and bolts and blocking and tackling. Back to what I mentioned earlier, the process can really seem painful from the outside in, but there's definite real considerations that have to come in several domains. One is cybersecurity. So that is huge. And if you follow some of the current cybersecurity research, right, in the top 5 industries that are being targeted, it's healthcare and education. Higher ed is always top there. So as an AMC, we're in 2 of those top 5, right? And it's a real risk. We do have constant threats here. And so cybersecurity is hugely important. On top of that, there is, related to cybersecurity, but it's a spectrum. We also think about our data. And so there's protected health information, PHI, and there's a lot of legal considerations around the use of that health information. And we do need to protect the privacy of our patients, right? I mean, that's a very big topic these days, is how's my data being used, right? I went to go see the doctor and you have my information from that office visit, but then what's going on behind the scenes? So we take that very seriously. So again, when we come into this space with startups, I know as a data person, I understand how valuable it could be to use data to build really cool solutions, but we have to be sure that we have the right guardrails in place. And then as you move down that, as you continue down this continuum, right, the data side leads into privacy questions that I just mentioned, right? And especially these days, there's a lot of AI involved in technology. And so that brings in responsible use of AI. Like, what's the transparency around that AI and the use of that data? What's the responsibility around it, the accountability? And then you just have basic privacy regulations that we have to keep in mind. And so there's a compliance perspective too for all these things that we have to do. And so for us, a lot of this stuff is essentially table stakes. And so you can have a really good solution, but it is important from a broader institutional perspective, from an enterprise perspective, to know that we have at least that standard when it comes to compliance and cybersecurity, to the tooling itself, that it has to then work well, or has to really check off these boxes. Otherwise, it almost is really, I mean, there's no way, if something's not secure, if something's not handling the data properly, it's really almost a non-starter.
Yeah, completely agree. And just for some context too, so we have innovators at all stages of their startup journey on with us today. Some a bit earlier stage, some in the growth stage, and I completely agree with Frank. We know how scary that process can be to walk through what those minimal requirements are and understand, what you need to make sure that your technology is up to par to work with someone like a Frank at UW. And so at ScaleHealth, we want to help remove some of those barriers. So for anybody online that may be struggling to understand that space, could use some support and some guidance on how to navigate what those best practices are, please feel free to reach out to us. We're certainly here to help try to demystify all of that a bit. So really easy to get in contact with us at Scale if that's something you'd like some more support on. To transition a little bit more to talk about the specifics of this workforce challenge, I referenced it on our last webinar last week with St. Luke's health system. And I'm sure, Frank, you have your own perspective on how UW has been impacted by the COVID-19 pandemic. And of course, all of the implications that have trickled down as it relates to some of your maybe staffing concerns and workforce concerns. And so I'd love to, I think it'd be a mistake to ignore that topic and just see if there's anything that comes to your mind in terms of, how you've uniquely been impacted by these, past few years that we've been in, and what's the status of, how UW is working through some of those challenges.
Yeah. So I think to say that workforce is a challenge might be an understatement, and I'll kind of lay it out in a second here, but I think this is where technology really can be a value enabler. We have a saying that goes right with it from our CEO about reimagined work, right? What does work look like for the healthcare workforce in the next 5 years? And so this is a top strategic imperative for us. But I think if you haven't been in the industry, I'll just lay it out a few ways, right? I think we were already looking at a challenging situation. If you're familiar with the demographics of the country, and certainly Wisconsin is true, right? We have a population, the baby boomer, if you ever look at the demographics data, it's a real spike. And so as that population gets older, we know that they're going to need more medical care. And then actually within healthcare, you get it on both sides, right? You need more care, but that also means that some of your workers are retiring, right? So less hands and then more people to care for. Well, then along that comes COVID, right? So then during COVID, we know we had a lot of shutdowns. And so a lot of care stopped at that time. And then, of course, we had to deal with COVID directly. And you may have seen, the challenges there with, we certainly had a couple of surges. And while some of the surges ended up not being as high as we impacted, there was still a huge pivot for our workforce, right, to deal with this pandemic. And it was a stressful time for many of our workers. And so we saw a lot of workers drop out of the workforce. We had a lot of challenges around there. But not only that, even kind of after the surges ended, what people don't always realize is that then what you had was all this pent-up demand, because a lot of people didn't get care outside of COVID for 2 years. So one of my good partners, who's the co-director for predictive analytics, machine learning that I work closely with, he's an emergency physician, and he told me about a woman who he saw, like after around this time the surges stopped, she came in with a broken hip. Well, she broke that hip like 12 months ago, literally. But she just didn't want to come into the ED during the surge in the pandemic. She was worried, and he's like, she should have come in like, she fell down the stairs. She should have just come in like the next day, and she just held off. And so now, there's a host of other problems that have started because of that. And so if you think about a factory, where you stop the production line and everything gets built up, and then now you restart the line, you have this giant backlog. But in the case of healthcare, it's even worse, because while you've got it all stopped up, it's like bread that's going stale, right? So people are getting sicker and sicker while they're in that backup. And unlike bread that you would toss out, right, with people, we have to then care for them. So actually now their needs have gotten higher at the same time. So you've got the backlog, you've got workforces leaving and now leaving earlier, and then you've got people getting needing higher levels of care with that backlog. So you can see sort of like a perfect storm of all these things coming together in terms of the workforce challenges. So that's really, really, really why we have to think about not just working in a more efficient way, but even working in a different way.
Absolutely. I'm going to throw something quickly in the chat for everybody. It is the 3 challenge categories that are a part of the Scale CHIME Workforce Challenge. So these are just areas of focus that all of our participating hospitals have expressed interest in learning about innovation and solutions in these categories. Frank, I want to talk a bit about of these 3, like what is resonating for you? What's most top of mind? I know you've touched on the AI-enabled productivity tools a bit. So if there's anything else you want to add to that conversation, please do. But, when you see these 3 categories, can you tell us as much as you're able to, like, what are some solutions that you're currently implementing related to these, where maybe you'd be interested in exploring some alternatives, or what gets you excited when you kind of think of these 3 topics here?
Mm-hmm. Yeah, so I think they're all exciting. So let me I'll run through it, and India, feel free to jump in if you're like, hey, let's stay with that one or not, or redirect. But the AI one, as you mentioned, you touched on that with, for example, our use of GPT. And again, that was a way to see if we could help our workforce, right? Be more efficient, right? Manage, all these electronic messages. We saw, as a country, we saw like 157% increase in the volume of messages during COVID, and that increase has stayed, it hasn't gone down. So can things like generative AI help the workforce with that? We think about AI as efficiency gains for productivity to automate some of the work. I mean, some of this is, the concept itself is not new, but can we use either AI or even intelligent automation or even RPA at a higher level to then just automate some of this work for both clinicians as well as back office? And then as we do more and more of that, are there ways that we can streamline the workflow? So even back office processes, it's one thing to say, hey, you've got 10 steps, 8 steps that are manual. Can we automate the 8 steps? But then can we actually have a technology that lets you jump from one step to step 1 to step 4, right? Either through better information sharing or through some other kind of technology tool that allows you to make a decision much earlier in the process, right? Let's see, workforce engagement retention, right? So I think in some ways there's overlap with productivity, but I think there's also, what are the jobs of the future going to look like, right? If we have shortages with rad technicians, and we know that that more care can be done virtually, more things can happen, how do we then rescope some of these job duties, right? And how can technology help, like the rad tech of the future, do work differently, right? So it's no longer 5 years from now, maybe when someone says, hey, I'm like a radiology technician, what they mean in terms of their work is different than what it was before. And some of that is how we're struggling with the workforce challenges, but I think some of that will have technology come into play as well. And then staffing position planning. I know for us, this one really comes down to, for example, one area where we're thinking about this is in the hospital setting. In healthcare, we call that inpatient. But we have challenges there. But we've been thinking about, are there ways to do things virtually rather than in person? Some of you might be familiar, and we have a couple programs here where you can do a hospital at home program. So not just like an urgent care visit over the video, but even you can stay in your bedroom and still be considered as a hospital inpatient. And we have the technology now to monitor your vitals all throughout the stay while you're still within your own house or in the comfort of your own bedroom. And then as we do that, does that open the door for virtual nursing, right? So now nurses don't have to come in person, and that even has a side of the workforce where potentially you might have nurses that are more experienced, but maybe rounding on patients in person throughout the hospital is just less and less feasible, but they can still provide their wealth of experience, their wealth of expertise through these virtual touch points, and then still then work in parallel with the care team that's there in person. And so as we do this, those are some of the options that we think about. And then of course, the staffing piece is also huge. And how do we use data and analytics to do more precision staffing now that we have more technology and data at our disposal? And again, that is almost like an optimization problem in some ways.
Awesome. And I think we can touch on a little bit more of the specifics as we answer maybe some audience questions that are pointed towards one of those three topics. A few more questions before we close it out. And just a reminder for anybody, now's a great time to add any questions. We'll have plenty of time to circle back with Frank. So please feel free to use the chat for any comments, questions that you have that you want to discuss while we have some time left here today. Frank, you talked about it a bit as well already. I want to get your perspective on just over the next year or so, where you kind of see this part of the industry going. And you referenced it already around, redefining roles and thinking about our decision-making logic and tools and how technology impacts those. But just anything else that you want to shed a light on in terms of kind of what you're anticipating to see over the next 12 months or so and where you think this part of the industry is heading.
I do think that challenges create opportunities, right? And there's maybe that overused statement, like in the Chinese language, the character for crisis has the same components as the character for opportunity. So, as I painted a pretty bleak picture, I do think that it also opens the door for more opportunities and more ways to work. It does create that impetus. And so you've got these challenges that are going to lead us to having to do things in a new way.
Fantastic. And just a final question before we jump into getting some feedback from the audience. Any just final notes, words of wisdom, advice for any of the startups that are participating in this challenge?
I've always thought it was like you need some kind of special DNA to be a healthcare technology startup because of all the stuff I've said before, where, wanting to go through those pieces and work through like the regulatory side, the data side. And so I do think that my word of encouragement, my vision is that I think in the space of healthcare technology, I think there's always been a special call around the impact of the work and knowing that you are working on human health, you're helping providers. And so I imagine that has to resonate with people because, if you think about it from a pure start perspective, it's like, what industry do I want to go into? Well, let's go into the highest stakes, one of the most regulated industries with all sorts of like evolving and changing landscapes. So I really commend and applaud, what I believe, and even talking to other entrepreneurs, oftentimes that passion around really making a difference.
I couldn't agree more. It's great words to end us on. And yeah, we love seeing just the passion of our innovators. And, through this process, we're very excited to introduce you to many of the folks in our community that I think resonate with this exactly what you just said. So to jump into some questions, and please, like I said, if there's anything else that comes to your mind that you want to discuss now, go ahead and use the chat for that. But we'll just start off, Frank. Someone's asking, I think you touched on this at a high level, but just any more insight here. They're asking if you can share how your organization assesses whether an innovative solution can be sustainable in an ever-changing healthcare model. So just a little bit about your thoughts there.
Yeah. So sustainment, I think, is huge. I often think of it as scaling and sustainment as almost two different things, two different types of activities. One is really continuing to keep like can we continue in the operating model for sustainment, and scaling oftentimes involves a little bit more of what we call organizational change management. And this and a couple of these questions, I think you may just get more the UW Health answer, right? And this is where I think these webinars are really helpful, because I think there may not be a right answer. But I know that for our organization, how we often think of it is really an iterative process, right? Many of you are probably familiar with things like Agile. And here, when I say Agile, I'm not talking about backlogs or Scrum Masters. I'm talking about that mindset of iterative approaches. And so I do think that taking an Agile mindset for that innovative solution. And so you're thinking one step ahead for, what is the first step and where do we get started, right? So where can this solution be used, this innovative solution? And at the same time, we're thinking two steps ahead for, what would be the next step to scale and the next step to sustain. But I am also a believer not necessarily chewing off too much than you can bite. And I think that Agile mindset does help with the changing healthcare model. And in some ways, like the solution itself may change the model. Like that is sometimes part of the idea. And so you don't want to over-engineer it. So I think in some ways, it's the difference between having a prescriptive path and saying, okay, we're going to start with this specialty, and then we're going to expand to these next 3 specialties over the next X months, and it's all prescriptive and laid out, versus having more of a playbook that says, hey, we'll start with the specialty, and here are the 3 areas we could go, and here are the toll gates for each of those areas.
Awesome. Next question. I think this is a great one, John. The question for you, Frank, is a little bit about if you can share what the what a partnership with UW would look like in terms of the steps that would be taken for potential implementation. So I'll just kind of give some insight into what John's question is asking for some clarity on in specific. So talking about how you go through the contracting process for potentially bringing on a new solution. Is your preference to run a pilot first? How does that look like in terms of other departments that may get involved from an IT perspective or legal in terms of assessing, those solutions prior to a pilot? Is that something that would not take place until there was a full kind of implementation process to go through? And just any, examples you may have of successful pilots that have been run in the past and what that looks like in terms of expanding throughout the organization.
Yeah, it's a great question. And again, I think this is one where you're going to get my flavor of the answer. So I do think that from what I just said, I think we always have to think enterprise, but I think of the enterprise playbook, but the execution as being potentially, the execution itself can be done in an iterative fashion, right? And so you may have a we start with a pilot, and I would say often we do start with the pilot. So even if we have an enterprise playbook, where we'd start would oftentimes be a pilot. Now, this is going to depend on the nature of the solution, but I'll just say that in general, like a pilot to test it out is really critical, because you do need to answer some questions on, is this solving the problem that we're looking to solve? Like, what's the value that we get out of it? And so having that pilot help to start answering those questions is really important. And then you have that playbook for how do we both sustain and scale as we go further out. I think for us, and I think that's especially true for us as like an academic medical center, if you start enterprise, there's a lot of discussions that have to happen that I don't know always will, you have to really front load the discussion a lot. And I don't think startups will necessarily always get a lot of value with having lots and lots of enterprise discussions without us even really starting to see what the solution looks like. The contracting question is you still have to get a contract, right? And that's the challenge, right? Is like we might only pilot in special care, but some of these things like risk assessment, legal considerations, there's also, things like a BAA, right? When we talk about HIPAA, like a BAA has to be in place. It doesn't matter if like we're only going to scope this for one part of it. Most of the risk assessment is going to have to be true no matter what as well. So all of that stuff, like the contracting and the legal, like I mentioned, all of those regulatory and legal considerations around governance, risk, and compliance have to be settled no matter what. And I realize that is one of those challenges, which is why I think, this ScaleHealth CHIME challenge is really good, because you get some of those table stakes out of the way. But regardless of the scope of the pilot, these are the things that have to get established no matter what.
Awesome. Yeah, very helpful. Next question. So someone's referencing that they have a tool that aims at improving task and skill alignment and reduce burden on nursing teams. Frank, can you share a little bit about how UW thinks about the ROI of workplace efficiency gains?
Yes. No, you know what? I just realized, India, I'm going to add a little more to John's question too, because you've got the contracting, which is like table stakes. You've got like the pilot, which is where the solution starts. But one other thing I'll call out is there's also that operating model. And that's what I meant when I said sustainment is different than scalable. And so then how do you actually keep the solution running? How do you support it? And then what does it look like to keep scaling it? Those are oftentimes really important questions. And that's where there can be some push and pull with like, yeah, we have to get all the legal stuff in place, but then what's the level, what's the team that's needed around this? And that's where you can have some place where you say, okay, for the pilot, this is the operating model that goes for the pilot. But as we grow and scale it, the operating model can evolve and adapt. And then to get to your next question, so ROI of workforce efficiency gains. So I will tell you how we're thinking about it today, and I think this is always evolving, but I do think that as a place that has started to use technology in a lot of different ways to address workforce, maybe this is a helpful answer for you all. We start with the framework. And so with this framework, there's usually 3 or 4 questions around this. So number one, does it actually help our workforce become more efficient? Number 2, do the users actually like it? and I'll expand on that more. And number three, are they using it the way that it should be used? And so those are important questions. And so like the number one is, I think everyone goes into like efficiency gains, right? So can we measure, is this making our workforce more efficient? And that's obviously like a metric, an OKR, an outcome that we should be looking at. The other part though, that I think always has to get coupled in is, do users like it? And so, for example, some of the stuff we've seen with like using generative AI to help our workforce with pre-drafting documents or summarizing things, is that in some cases, the drafts are actually longer than what the provider would have written. So it actually takes more time for them to go through it, but they actually like the tool because it's decreasing cognitive load for them, right? It's getting them over that blank screen syndrome. And so I think if you only zero in on efficiency gains, you may lose a lot of the benefits, especially in the workforce arena. And so that's where we also then want to look at things that might be more like qualitative metrics or other types of feedback from our users, because if they like it, there's also value in that, especially these days with our workforce being challenged. That is a that's a real one. And the third is it doing what it's intended to do? And I think that's always an interesting one because, and I think that's where a lot of the value comes in when startups partner with health systems, because I will tell you time and time again, I've seen like that initial prototype, that initial version of the technology just change from what we thought it would be when we actually put it in the hands of actual real users in the health system. And so is it being used the way we want it to be used is actually another key thing. And then also, and maybe for me, this is higher because of my area with emerging technologies, I'm often dealing with newer technologies that we might not know what to do with it, like especially with generative AI, like sometimes there's no regulation around it. So we have to establish guardrails and say, are you actually using this tool the way we intended it to use? And so sometimes that's another piece, like safe usage of the technology and not what you might call off-label usage. So like using a predictive model to like make a decision that's different than what it should have been used for. And so those are some of the things that we look at. I'll share another anecdote too, to just show how oftentimes this is a little dynamic. So for example, we deployed another tool to help with our workforce where like India, if you were a patient, right, and we said, oh, you have to go and see a specialist, right? Maybe you have to go see a urologist. Well, right now, because of some of the access issues, that appointment for that urologist might be really far out, right? Like a year, and it's like, oh no. So, some of the things we've been doing is, well, when you go see that urologist, oftentimes you get a workup. Like they'll just order a standard set of labs and things that then they look at that and say, okay, this is the next step. Well, that kind of workup is fairly standard, or at least it's always standard components. And so if I were the doctor referring you to the specialist, could I just actually order that workup and save a lot of that time now, right? So we started moving down that path. And so, yeah, it saves like a visit. It kind of gets some time in. It helps with the patient. But some initial feedback we're hearing is now our specialists are getting slammed because they were like, I needed some of those easy ones where India comes in, it's our first visit and I get to know her. I just do the standard workup. Now my day is like filled with all the hard stuff back to back to back. And so to me, this is the fascinating part of what we do, right? You use technology to solve a problem, but you have to keep thinking about how do you keep iterating to really solve the entire problem. But I just share some of these anecdotes for this audience because I think they may be helpful.
100%. So, thank you for sharing that. We have one final audience question before I turn it back over to Taylor, our host, for some closing announcements. Quentin, I think this is a fantastic question, so it's a great one to end on. Frank, the question is around like integration. So if you can tell us a little bit about if there are particular platforms that UW has that our startups need to be considering, how they can integrate with your current systems. Just give us some insight on what that process looks like, what you guys are using now, so people can think about, how they may be able to support the current structures and systems you guys have in place.
Yes, absolutely. And this is actually a really huge topic too. So I'm glad someone brought it up, because when we talked about like the contracting, the legal and the rest, all that table stakes, there's another side around like technical architecture. And while I wouldn't call it table stakes in terms of like the threshold, it is a huge consideration because as a health system, and this is where every health system is going to be the same, is that there's certain enterprise platforms and enterprise architecture that we have. So we have an EMR. We happen to use Epic, and most academic medical centers do. And so if you want to have something that's within the workflow of a clinician, then you do have to think about how does the solution integrate into the architecture, right? And does it have to integrate directly into Epic? If some of the data that you need for that technology is in the EMR, then there has to be data integration. But then if you want to like expose a UI or some kind of decision support, then it has to be integrated, right? And so I think technical architecture is oftentimes another piece of it that needs to be considered. I wouldn't put it like as far upstream as some of the contracting pieces, but I will say that then it does become part of the discussion. And it factors into, if you pilot and you start in a certain area, then, what's the architecture today versus the architecture 2 steps from now. But yeah, we do have we have like, the enterprise architecture, enterprise platforms that include things like Epic or, ServiceNow for a lot of our workforce or service management platforms. And so depending on the solution you have, thinking through integration is important. And I would put integration in 2 categories. There's data integration as well as what I would call like more that application level integration. And, within healthcare, interoperability is always one of these topics where there's a lot to talk about. But I think because of the nature of healthcare and the high stakes with having the data there, interoperability is always a big consideration.
Awesome. Thank you.
That in itself could be another whole topic, right? But I think this is a good opener.
Totally. No, thank you for appreciate the question from the audience, and your response, I think, is very helpful for those online. With that, we are just about almost at the end of our time. Oh, we have one last question. I'll throw it in there. Oh yeah, this should be a quick one here. What time and attendance system does UW use?
We have
Frank?
Simpler, and I think that is one of the more common solutions out there. And then on the interop too, I will talk about, the standards are really helpful. So you may have been following some of the stuff from like a group called, a government group called ONC, and there's a lot work that's been done to promote the FHIR standards. So I think always starting off with the standards in mind, but also realize that with healthcare, it's an evolving challenge, right? Just because to say, hey, I have all the FHIR standards right now for where we are, there's still a lot of plumbing that has to go through. And I say we as we as an industry. So the FHIR standards are getting us closer, and you have things like US CDI, if you're familiar with that kind of help to start to put some more meat on these standards. And so I think definitely think about the standards that you have when it comes to interoperability, but know that there's still work to be done. And I think that is the current challenge of interoperability today. It's not plug and play. And in some ways, because of the high stakes, there's always going to have to be some level of work when we talk about integration.
Awesome. We have one last quick one, Frank, and I think this is this could be a whole webinar in itself too. So maybe just a few thoughts here, but just a bit of insight into where UW is on their journey of journey towards value-based care.
Oh, I mean, it's huge for us, right? It's I would also say it's very strategic for us. We have, an attributed population, if you're familiar with that model, where, the work where we work out something with our payers, where we're really taking care of a population. That's called a capitated model. We are also what's known as a next gen ACO. So that's with the government. And so ACO is accountable care organization, where you take care of a specific population, and a next gen is sort of one of the evolving models. And so there's a certain number of ACOs in the country that are known as next gen ACOs, where we do a higher level of risk sharing between us and the payers. So value-based care is a big part of what we do in terms of, I would say, operations as well as where we want to go.
Fantastic. Well, thank you so much, Frank, for the time. This was great just to have you online with us, take an hour out of your day to share your thoughts and perspective with our innovator community. So thank you for that. And thank you all for joining us. And at this point, I will transition it back over to Taylor with just some final announcements before we close out here.
Amazing. Well, thank you, India, for doing a great job moderating the session. As always, love seeing the engagement and the enthusiasm from everyone here. And Frank, also thank you for taking the time, and a big thank you to the whole UW Health family for this partnership. Speaking of partnerships, I just want to kick it back very quickly to John Mark Green from the CHIME team. He's the Director of Innovation, in case he has any final comments.
Thanks, Taylor. I really appreciate it. Really interesting. Thank you so much, Frank, for those great insights. I've been making notes, and this is it's going to be great food for thought. Just wanted to put it out there in case there are some on the call that missed the results of the last patient engagement challenge. I'm going to pop in the chat there the link to the finalists videos that we did. And I noticed one of our founders is actually on the call today, Akshay, and so you can take a look at that. And just wanted to kind of give you an idea of what that looked like last time. And also, we're trying to kind of parse some of the results of some of the content that's generated at the Innovation Summits. Taylor was at the Innovation Summit we had last week in Charlotte. And these are provider summits oriented toward providers, helping providers do innovation better and giving them tools and resources and networking. And so there's a summary that we put on the Digital Health Insights platform. And if you'd like to take a look at that, that's the link to the channel there. And we have a write-up on basically what was covered, some interesting links in there. And if you'd like to keep up with some of the content that we're putting out on innovation, this is the place to do it. It's all published on our innovation channel at Digital Health Insights, and we'll be covering the challenge there as well, so you can keep up with some of the things that are going on with that. We're really looking forward to working with you for the rest of the challenge. It's been a lot of fun. Learned a lot already just by listening to what providers are interested in. I posted in the chat a little bit earlier some of the top workforce challenges that our host in Charlotte, Andy Crowder, their top 5 workforce challenges in Charlotte that I thought were really interesting that he showed on the slide: burnout, separation vacancy, premium labor, workplace violence, which was a real surprise, and cost and margin pressures. So everybody's feeling these things, and we're doing our best to try to get people together to try to find the right solutions together. So thanks again for partnering with us, and we look forward to seeing how it turns out.
Great. Thanks, John Mark. Just a quick final note. You're going to be receiving an email in the next day or two for next week's webinar, which will be featuring Tressa Springman and several members of her HR and innovation teams from LifeBridge Health. Look forward to seeing you all at that one. In the meantime, India just put in the chat the link to either sign up or continue your journey through this particular challenge. Please make sure you, one, if you're not already participating, we would love to have you join us. And two, once you're in, please make sure you go through all of the various assessment stages to put yourself in the best possible position to be featured amongst our finalists. So with that, thank you so much for joining us. If you have any additional questions, please feel free to email me at taylor@scalehealth.com. Happy to support wherever we can, and look forward to seeing you again next Tuesday. Thanks, everyone.